JC is a fascinating place. We have so much talent. If you pull up any topic and talk to a membership director or from personal experience, you'll find experts in every corner of the pews. And in this case, I found not one, but two people with a background in immunology and virology. One is Bob Braden, who used to be a full professor at Anschutz. I'll make some comments later on. He's long since retired. And then Marci Sontag is actually smack in the middle of that field. And even more in the middle of it is Dan Matlock, who is a medical doctor who sees patients. And so I figured let's invite them all to give us their perspective on why it takes more than science to vanquish the pandemic threat that we are facing. Dan, I think you are on call. You may not be able to stay all the time, so why don't you go first? Well,
so I'm happy to have questions and a conversation too. As far as the second question, talking with people, that's not as hard. It's sort of changed. I think one of the things that struck me about watching the video with smallpox was when they showed those statistics that 30% of people died. And I just wonder how much the fact that it was so lethal helped create a situation where people were willing to rally. And you know, they showed right next to the COVID and it was only 1.5. And I remember thinking in COVID being really frustrated with saying this isn't real while I'm taking extra shifts while other people are moving into shifts in the ICU, and we have people in the hallways, and we're running out of beds, and we're wondering what we're going to do when we run out of ventilators, and then people are saying this is fake, and I just couldn't understand that. But then if you think about it, if it's only 1.5%, a lot of people were never really exposed to somebody who died. And I think with smallpox, I think it's really different, because I bet a lot of people knew somebody when they showed the, pieces of pie getting eaten out of countries. That wasn't I mean, a lot of people died from COVID, but it wasn't like a chunk of the pie. So I think there are people who didn't see people dying. And I think that created conditions that were a little different. It was really frustrating, though. I mean, it almost would be easier to do a Q&A. I don't really have a planned talk, so if you have questions, just raise your hand and follow up. But yeah, so I think that, you know, where it takes more than just policy, I think smallpox itself was almost a unique case in being as lethal as it was to create an environment where people could do that. As far as talking with patients about vaccines and how to overcome sort of that ambivalence, I think that's changed. I think it used to be a strong recommendation is what we do. And there's even some studies saying where they say they randomize people to giving a strong recommendation for vaccines or doing more of a patient-centered shared decision. And people got the strong recommendation. These were parents of some, I forget what pediatric situation. But when they just made the strong recommendation, people were more likely to take the vaccine. I think post-pandemic, I think that's changed. I think the amount of distrust is just through the roof, even among people who were sort of aligned with this before. And so I think coming in with that approach just creates a wall and even more distrust. So at least my approach has changed to being one where, you know, like when I'm talking to someone about the COVID vaccine, for example, I'll be like, you know, I do recommend it. I think it's really important. You know, when COVID first came out and the death rates of those early strains were really high, I recommended it much more strongly. But now I say, if you choose not to get it, I'll still be your friend. We can still work together. I'm not going to tell you no. And, you know, that's a debatable thing. There are pediatric practices I know of where they say, if you aren't going to get vaccines, I don't want you in the waiting room with my kids. You can't come in here. And, you know, that's more of an ethical debate on how we handle it. But with adults, I'm a pediatrician, so I see seniors. I don't push the vaccines as hard. I recommend them. but I recommend them and then tell them my case, and then I try to tell them I'll still respect you if you don't. And I think that keeps the conversation going better than a recommendation and then pushing them. Yeah?
When it started, it was assumed that what we had known before was what was happening again. It turned out that some of that was, the assumptions were wrong. And so then, and with all this conversation coming about don't believe, don't believe, don't believe, and people keep changing because the knowledge was changing, I think that was part, I mean, at the time of COVID, my husband was in nursing care, in assisted living, was dealing with a dementia. So I was glad for I was just so pleased this church kept telling me what to do and what not to do. And I just was glad to follow it. But I think when you were getting different kinds of instructions, because I remember the beginning I was with a doctor and he says, you do this, you stay at least 6 feet away and then you're fine and blah, 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 or whatever. And then it turned out we weren't dealing with something we knew with.
Yeah. No, and I think we didn't do a good job as a medical community communicating the uncertainty. We talked in ways that sounded like we were more certain, I think. And then, I don't think we were. No, I don't think we were. I think we had too many unknowns. We were not certain at all what was going on. It was crazy. But then the messages that get out created a feeling of more certainty than I think we had. And then when it turned out that we didn't have that certainty, the distrust just entered, and it's kind of hard to follow.
Struck by the movie to show the concerted effort to eradicate smallpox, and obviously the World Health Organization had a big key in that, and now this organization is also under siege, as we can experience. I mean, why is that? I mean, it's such a big success what they did, and I mean, they should get some credit for that.
Yeah, it's a political question. Actually, how that happened. There is actually a history to all of this in the United States, which is about 200 years long. There started and still is a movement called health freedom. And it was kind of part and parcel of the United States having been a colony to Britain, and everybody hated being regulated by the government, because at one point that government was Britain. And out of that came this health freedom movement, which had some really nasty effects, and is also effects that last into today, because if you're ever wondering why supplements are not regulated by the FDA, it goes back to that history of health freedom, where there was an exemption carved out to basically sell snake oil. And not just snake oil, but also the licensing of who could practice medicine hasn't been strongly regulated in the United States, had not been strongly regulated for a fairly long time. So here it was always easy to basically claim to be a doctor and practice quote unquote medicine. And going back to that book title, I'm pimping here, Science Under Siege. If you read it, you'll find that there are real unpleasant interests, political and commercial interests, in pushing an anti-science agenda. Part of it is proven to have come from Russia, which has a long-standing campaign to undermine unity and trust in the United States. A lot of the stuff that is being pushed, not just against climate action, but also against vaccination comes from Russian server farms and bot armies. Saudi Arabia was also involved, and so I mention this because it's kind of an infection by itself. The kind of propaganda that people are exposed to is hard to believe. Many of you in this room, this is a very liberal place, will probably never watch Fox News or tune in to the hell and brimfire. Brimstone and hellfire Christian media. But if you did, and there are some hardy professionals who monitor that huge space, it reaches more than any other type of media. It is totally polluted by outright lies and defamations of science in general, climate change, and vaccinations in particular. And at the same time, one thing that everybody will notice whenever they switch on Fox News or any of the right-wing YouTube channels, they're constantly interrupted by advertisements for what I would guess are worthless remedies and fake medicines. There's a lot of money to be made, and the book Science Under Siege also mentions the size of it in the billions. If you are a health influencer, you can become really, really rich. One of these folks claims to have made 100 million plus in this market. So there's a very strong economic incentive for pushing bullshit. And if it were just bullshit, I mean, that's useful. You can put it in your garden and grow plants better. But in this case, it kills people. It milks them for worthless supplements that they don't need and that won't help them. And that was especially pernicious in the case of ivermectin, which was pushed relentlessly on the right side, and the result was a term that was also a book title called Red COVID. If you compare death rates by voting habits or voting patterns, there's a very strong divide between independents and Democrats and Republicans, because they are constantly, still are constantly fed pernicious misinformation that vaccines don't work and vaccines kill more people than it helps. It's kind of hard to believe if you just hear it from me, but the way that propaganda works is repeat something, whatever it is, 17 times, 20 times, and if you happen to be listening to the radio or Fox News day in, day out, you won't hear that stuff 17 times. You will hear it 100 times. You will also hear it from an entire staff of people with look-alike credentials. They look like they're valid. There's a doctor from Stanford. There's a professor from Harvard. Or maybe even somebody from Johns Hopkins. What they don't tell you is, no, virology is not their specialty, but they're in a different field. So the chyron below the video of those interview guests will tell you, Ivy League tells you this is believable when it is not. And with that, I will stop my rant and hand it over to Marci Sontag, who actually has a PhD. I'm just a college dropout who married into brains.
Thank you so much, and thank you so much for inviting me. And I want to say, when I walked into the room and I saw Bob Braden here, for those of you who don't know Bob Braden, I'm an epidemiologist. I was trained at the University of Colorado. And when I was in school, Bob Braden was the expert in immunology and vaccinations. And then I came to JUC, and Bob Braden's here. And oh my goodness, do you know what? Like, so really, thank you, Carol. Like, Bob is just so. I feel ridiculous standing up here when we have such an expert. So I'm going to say some things, and then Bob will come up and say, no, let me fix what Marci just said. But so much of what I learned from Bob. So I am an epidemiologist, and we study patterns. We study patterns. And when I was invited to this, I thought I was coming to listen. And then I read the email this week and went, oh, he wants me to say some words. So here I am saying some words. And so I've done a lot of research, not a lot of research, but a lot of studying of vaccines, a lot of thinking about them. Study more on the infant side, newborn screening. There's a lot of things with the newborn screening, the tests we do in newborns of hesitancy, of what is the government doing to us? And that's where I think we are a lot with vaccines right now. So among very well-educated people, I'd love to know what you think. There's a study posted by the WHO in the Lancet that was about how many people have been saved by vaccines. How many lives have been saved? What do you guys think? No. Over 50 years, how many millions? Lots of millions. Millions and millions. 154 million lives have been estimated to be saved by vaccines over 50 years. Like, think about that. That's half of our current country's population. That's so many. And then we think of the COVID vaccine. Another article, I need to pull this one up, of the COVID vaccine. Now, how many lives might have been lost had we not had the COVID vaccine? And there's so many people who now say, we didn't need that. COVID, the gaslighting that happens with COVID, right? It was just a little cold. We all lived through COVID. Why didn't, like, it's fine. People didn't really die. Yeah, they did. And I think many of us in the room know people who actually did die, right? And so the estimated total number of deaths that would have been averted because of the vaccine is about 2.5 million. Yeah, gasp, right? That's a lot of lives. Now you look at that over the course of our lives, of our ages, and among children under 20, not that many. Very few lives were saved because of vaccines. But as we age, that became much more important. So as we were among 50s, 60s, and especially those of us over 70, that's huge, the lives that were saved. So the vaccines save lives, period. It's one of the biggest public health advancements we've ever had. I'd love to say the biggest, but then you say, well, what about clean water? Okay, there's clean water, right? But this is one of the biggest public health advancements. And the fact that we are right now going backwards is insane to me. And I have yet another study that I'd like to show you, but I think there was a question. Did you have a question?
Yes. Long COVID continues to wreak havoc on lives.
100%. I just talked about the lives saved, the actual human lives, the deaths that were averted. Long COVID, huge. You look at, and we'll continue, we are doing a terrible job, I think, and maybe Dan can correct me, but I don't think we're doing a good job of studying long COVID. My 23-year-old daughter had some symptoms of long COVID. Like, people have it, and nobody knows about that. Nobody knows what she's going through. We don't have that good study of that. But if you look back 50 years, people who had measles, people who had, people had long sequelae of all of those diseases, and I just gave you the facts of who died. Vaccines have not only saved lives, they've changed lives. We've prevented some of those bad outcomes as well. So right now we see a lot of things with vaccine hesitancy. So another JAMA study. Right now we're seeing vaccine hesitancy. What's causing vaccine hesitancy? Fear. Yeah. Fear of what? So I'll repeat this for the recording, because we are recording this. It's the fear, it's the distrust of doctors, the distrust of the CDC, distrust of the government. And that's especially become the case in the past 5 years. Since COVID, that's become the case. We've really become scared and said, we don't trust the government. True, and I will admit, as being a public health person, we made some mistakes in COVID. We didn't do everything perfectly. We did things under the best of what we thought was at the time, but we didn't do it perfectly. But there was even vaccine hesitancy before COVID. And I think we touched on it a little bit earlier. If a third of the people, Dan said this, if a third of people die of smallpox, you're going to want to get the smallpox vaccine. I've never seen anyone die from the measles. I've never seen anybody who's had the measles. I've known people who've had the measles. My mother-in-law over here said, a lot of people in this front row say they've had the measles. I didn't live through that, though. I've never seen people, I knew people who had chicken pox, but that's now, we have vaccines for that. So we don't see it. So we go, how bad could it be? You lived through the measles. You lived through the measles. You guys are here. It's fine. We didn't see it. So there's also people who are saying, I don't want to give extra things to my children. I don't want to give them those things. I want to spread it out a little bit. Our president recently said we should spread out the vaccines because there's too much liquid at one time. Literally, he said those words. There's too much liquid in the vaccines to give to a child at one time. What the heck does that even mean? But people are also thinking we're exposing them to these things. You're supposed to give them to it 2 months. Couldn't I give it at 2 and 4 years? And couldn't I just spread it out? Well, one thing to know is the vaccines are so incredibly well studied. And I know Dr. Braden could tell us this too, that it's one of the most well-studied things. I sat on a dissertation committee where I actually chaired the committee of a student who was studying vaccines. And it's not just looking at death, it's not looking at autism. Both of those things have been studied. They're looking at eczema. Are kids getting more rashes because of vaccine? Are they getting more asthma? All of these things are carefully studied. Vaccines are one of the most studied things we have, and they are incredibly safe. And we in this room, the 20 of us, we need to help get that word out, that vaccines really are safe. And Colorado has been a place of low vaccine uptake. Over the years, before COVID, we were in the 80–85%. Nationally, it's closer to 90%. And that's where I want to get to this next point of, what if more people start declining vaccines? So if we say we're at about 85%, and over the next 25 years, we get down to 25% more people say they don't want to do vaccines. What does that look like for us? So for the measles, that takes us from, over the next 25 years, there'd be about 850,000 cases of measles, just what we expect now worldwide. So 850,000, if we change that and we say 25% of us don't want to get vaccinated, that's 26.9 million people who are going to get the measles. That results in a lot more deaths. So I think on this next page I've also highlighted the deaths that would result in. So many more people will die, and that's where we are right now, is that we are now at a group of people who are saying, I don't want to get vaccinated. I don't want my child to get vaccinated. I've never known anyone with measles. My grandma had measles, but that doesn't matter because my kids don't have it. It's not there. But you saw what just happened in Texas, and 2 children died. Children shouldn't be dying of the measles in 2025. This just shouldn't happen. If that's one of our children or grandchildren, we'd be heartbroken. This shouldn't happen. And so back to what Dan was saying earlier, as an adult physician, he can say to all of us, you know what, you don't want to get the COVID vaccine. I really encourage you to, but if you don't want to get it, that's kind of a personal choice. But for these childhood vaccines, we need that herd immunity, because vaccines don't work for all of us, right? For some of us, vaccines might not uptake as well as it does for others of us. So if it doesn't work for me, but it does for the rest of you, the herd immunity in this room is going to protect me because you all have been vaccinated. So we're vaccinating ourselves not just for us, but we're vaccinating ourselves for the community. We're taking care of each other. And that's, as a church community, that's what we do, right? But that's what we should be doing when we're getting vaccinated, is thinking about, yeah, I want to take care of me and my children, but I want my child to also be taking care of the other kids. And that one kid who's immune compromised and he can't get the vaccine, because all the other kids have had it, that kid's going to be okay. Or this child's too young to have the MMR vaccine. Well, now that mom is scared to take her child to Texas because the measles is rampant in Texas. So she feels scared to leave her house because so many kids haven't been vaccinated, and she has to wait till her child is older to get vaccinated. So we do this so we can take care of each other. And as each person decides not to, then we're going to have those breakthrough cases that even though I was vaccinated, it didn't work for me, and now I'm sick. So it's just critical. So where do you go to look for information? Yeah.
I'm wondering, does Governor Abbott, does he carry I'm curious if Texas Governor Abbott, if he carries, much weight in regard to vaccinations for measles.
I don't know a lot about Texas politics other than I know Governor Abbott carries a lot of weight. And I'm guessing he's not saying, go get your measles vaccine. Should he? Yes. Governor DeSantis in Florida just said, we're not going to require vaccines anymore. He just said, we're not going to require vaccines to go to school anymore. And that's one of the things where we have said, yes, we have to do that in our state. And nationwide, we've said it. This is the first state to say we don't need it. That's the difference in choice. In adults, we say it's okay because it's an individual choice and it's not going to have that widespread effect. For our vaccines in our children, it does have that widespread effect, and children are dying because we're not getting vaccinated. So I think Governor Abbott does, right? Mary?
Also, there was just a poll published 2 days ago. I think it was a Maris poll, and it said that at this point, there's still about 75% of parents are still convinced that vaccinations in order to be able to go to school is a good idea.
Sorry. So 75%. Right now we're between 85 and 90 is what we estimate. So 75% is about a 10% increase or decrease, I guess. Decrease. I'm not going to be able to interpret all of these data, so anybody wants this JAMA study, it's a really great study, but it shows that just with a 10% decrease, so that's then 25% are saying we don't want it, it's not going to take long before these disorders or these infectious diseases are then endemic in our society. So it's actually my eyes, and I can't see it well enough, even with my glasses on and the light, but it's not going to be long. In the next 25 years, we're going to have these diseases are going to be endemic again. Those of you who lived through the measles are going, what the heck? I know kids who got really sick. I know people who died. These disorders are going to be endemic with, even as it's good, it's 75%, but that means 25% don't like it. And we're going to have endemic measles and polio. And, it's scary. You remember polio. You remember kids in iron lungs.
Yeah, the only thing that I was going to bring up is that the herd immunity argument does not seem to work with those vaccine deniers. They are not about we, they are about me. You shouldn't make me do it. It's my right to say no. And so it's been my experience, the herd immunity argument does not work with the vaccine deniers.
Yeah, and I want to add that there was something called the Great Barrington Resolution, which was a meeting of these fake experts, and they kind of redefined what herd immunity was, namely, basically, let the disease run rampant, and we'll get through it, and at the end of it, we have herd immunity. The WHO was not a fan. And it was not a fan because the death toll, if you compare this quote-unquote strategy with a rational strategy of vaccinating as many people as possible, as quickly as possible, the difference in the death toll was ginormous.
That's an official medical term, ginormous. 100%. No, Mary, you're totally right. Without getting any more political than I already have been, but that's who we are, right? We're the people who take care of each other, and we're like, it's all about us versus it's all about me. And that kind of defines the political sides in our country right now, is that I'm going to take care of me and my economic self and my health and it's about me, versus, yeah, I realize that you don't have as much as I do, so I want to help you, and I want us all to move forward together, and I want to look out for your health and your health and your health, or I want to look out for my health. And so that herd immunity thing's a hard thing. Dan, come on up here. If you're going to talk, you're sharing this.
One thing about the deniers, I think about, and I don't remember the statistics, but somebody did a survey on that, and about like 1 out of 10 were truly all me, and about 9 out of 10 were just questioning and distrustful. And I think there's a big chunk of people that are, in fact, convincible. I don't think the herd immunity argument is strong. I think, and you said vaccines are all safe, and I agree with that statement 100%. But I think every vaccine does have some side effects. And I think in this day and time, people are going to go find that. If you told them it was safe, and then they go find somebody who says it has a side effect, then all of a sudden they don't believe you anymore because you said it was safe. Which is why I think the approach is changing a little bit.
Safe and no side effects are different things.
Well, safe.
I get the COVID vaccine. It makes me feel sick for a couple of days, but better to be sick for a couple of days than to be in a hospital and be sick for several days.
Yeah, but some people might not consider that safe.
Right, but it is.
And the pericarditis in young men, I think that was a real effect from the COVID vaccine. They have a really massive immune response, and a small number got inflammation around their heart. Now, the virus itself is like 10 times the rate of that inflammation. But when we pretended like that didn't exist, and it did, we lost trust.
Yeah, and I say they're safe. And yet, when my 20-year-old son said, should I get the COVID vaccine for that very reason, I said, no. I don't, there's side effects that I've seen in young men. And also, you don't need it because the disease is not going to get you. If it was a different disease, I might say yes. But I'm like, I don't think you need it. So I do think the COVID vaccine is safe. I really do. And yet there are some side effects. And so for him, I said, I don't think you need it for your situation right now. And that's where it's that personal decision. However, for the pediatric diseases, I think we take the decision out of families' hands and we say it's the government saying that you need to do this for your kid and for all of our kids. And might there be some reasons why we wouldn't say that?
And it's a very good point about the pediatric necessity for vaccines, but let's not forget COVID is not the end of the story of epidemics and pandemics. It's just the beginning. I read a science fiction book which had the most horrible sentence I remember, and they were talking about how they had learned to deal with pandemics and epidemics. And the sentence that shocked me so much is they had learned to deal with those epidemics and develop protocols in the COVID epidemic of 2021, 2025, and especially 2027. And you laugh, but it's true. A bigger one's coming, and one of the statistics in the film that impressed me, I think they started out with that. Everybody gets it, 1/3 dies. With COVID, thanks to the health measures that were developed in record time, 1.5% died. But that is not. That was a lucky stroke, so to speak.
And I would say if the population had been flipped like it was in smallpox children died. in COVID, elders died. And a lot of people could make the excuse, well, they were elderly, they were diabetic, they were sick, they were gonna die anyway. And that's horrible. I'm not saying that's the right thing. Had they been children dying, it would have been a whole different approach, right? We went, oh, children are okay. And they were, and thank goodness they were. But there's a lot of scariness there. So I don't know what time we're supposed to end, but I did want to leave you with a couple, or at least have you have this information, that who do you trust for information, right? And so I think for pediatric information, we used to always go to the CDC. Well, for all information, we go to the CDC, and I just don't do that anymore. The top of the CDC webpage, it actually says now the government is shut down because of the Democratic agenda and something. Literally, it's on their webpage. So I go to the American Academy of Pediatrics for pediatric information, and somebody else. Dan, who do you go to for adult information? It is the American College of Physicians? The United States Preventive Services Task Force. So if you're looking for information about what should I do and what should I get for a vaccine, go to those places. Trust your doctor. Doctors are looking to those places as well. Don't make decisions on your own. Don't make decisions by Googling. My sister told me yesterday that she has done a lot of internet searches and Tylenol's bad and that would have prevented, I was like, oh my goodness, like there's so much misinformation out there. So it's these kind of conversations, and thank you, Martin, for organizing this so we could have an intellectual conversation about this. Yeah. Carol hasn't had a chance to talk yet.
I actually have a few questions. One is about the psychology of who wants and doesn't want vaccines, because I personally hate getting sick. I really do. And so I've always gotten a flu vaccine, and I didn't think I was doing that to take care of others. It was really because I didn't want to get sick. Same thing with COVID. As soon as there's a new one, I'm like, bring it on. I want it because I don't want to get sick. And I'm really curious about why people aren't thinking that that's a personal benefit to them. I mean, a lot of people do, but how did that get completely lost? And then the other thing is with the new technologies for vaccines, is there going to be one for the cold? Because I really hate that too.
Oh, good gosh, I hope so. Although, that's one that I say, suck it up, Buttercup. Let's just deal with the cold. Take your NyQuil and get some sleep and you'll be fine. Permission, and don't power through. Stay home. And I think actually we've all been a little healthier, that we've not been going to work, sniffling and sneezing and all that. I think some people just say, oh, maybe you haven't had the flu, and that's why you're like, oh, I'm okay. I don't need to avoid the flu, right? So I think that's part of it. But there's the personal sake, but that's a decision for you. And if you decide you don't want to get the flu shot, or I decide that's okay. Except that I know when I've had relatives and friends who are elderly or are sick or whatever, when my parents were in their 80s and 90s, I'm like, I'm getting the flu shot because I want to go see them and I want to make sure I'm not giving them the flu. I see you all nodding. You're like, yeah. So it's both of those things, right? But now we know your selfish motives, Carol. Just kidding.
I want to focus on polio a little bit. So I know it's come up a few times, and so my understanding from maybe Nova or some show or maybe a lengthy article I read. So they said that it's only endemic in 2 countries, Afghanistan and Pakistan, was it? But there are periodic outbreaks, especially in Africa and a couple of other places. And so my understanding is that the similarity between polio and smallpox is that they're 2 diseases that have no other vector except only from human to human, and we can't get it from any other way. So if we can just break that human transmission, we wipe it out. And vaccines are the way we do that, but the reason it remains endemic in places like Afghanistan and Pakistan is because USAID was the one supplying all of the vaccines, and there are people like ISIS who are attacking the United States and calling the United States evil and so on. And that is preventing wiping out polio from its very existence on this planet. And I don't know if there are other diseases that also have no other vectors besides only in humans like that we could wipe out forever.
Yeah, no, I heard the same story about why it's all political, why they can't get to those spots in Afghanistan and Pakistan. But that gets to why, the whole thing, it's not just science that's going to solve it. And I don't know if that, even illuminating that political problem is going to solve it. It's, somebody still has to be safe and go to those communities, and I think we're a long way from that.
I have to bring this up. The assassination of bin Laden did a terrible job on vaccination efforts, because in Pakistan, everybody knows how they got to bin Laden. They had essentially spies who posed as people in vaccination programs to scout neighborhoods, and that has created a lot of distrust in Pakistan for a maybe valid, but for a political purpose. And since you mentioned human-to-human transfer, I have to go back to that horrible stories of the pandemics that we haven't seen yet, because COVID, from what we know today, is they call it a zoonotic spillover. The most likely explanation for it that the most virologists believe today, based on data, is that it was transferred from bats onto secondary hosts, probably in wet markets in China, and then jumped onto human hosts. That is pretty well documented, and it is also how the SARS-2 virus around 2003 or so scared the world the first time. So it's both human-to-human transmission, but it's also the emergence of entirely new viruses that just come out of thin air, and often from mammalian hosts or birds.
Now, talking about the politicalization of all of this, boy, if that was the worst case that we had right now, a politicalization of science would be lucky, right? The science under siege is such a true thing now, and terrifying that we don't trust half the country doesn't trust the CDC or the NIH or all of these people who are sworn public servants who are there to help protect our health and protect our well-being, right? And that's how we get through this as a country. I'm scared. I'm very scared, as somebody who gets most of my funding for my little nonprofit from the federal government to do work for the public health. They're now saying, yeah, we don't think that work is important. So we have to figure out a way to divide or come to overcome our divisions, right? I mean, it's just terrifying. So polio is probably going to be the least of our worries, because we're just so divided, and science is now bad. I don't believe in science, is what people say, and science isn't a thing to be believed, right? This is not it's not faith. It's science. It's fact. It's science, right? It's science. So it's what? The mega virus. Do you have a vaccine for that, sir?
Yeah, I can talk. I promised Bob Braden that he could chime in.
The only thing Marci, I've been retired for 11 years, and you can forget a lot of stuff in 11 years, so don't worry. Practicing 40 to 45 years ago, I remember seeing a case of a young boy with tetanus, and you can't believe how that family would have wanted a vaccine instead of the boy having tetanus. It was horrible for that boy. I've taken care of kids that have died of whooping cough and who have died from Haemophilus influenza, which are now vaccine-preventable diseases. And the parents would have so wished for a single shot to keep their child alive instead of dying from those diseases. So, I don't know, I was lucky to practice through 45 years of seeing dramatic improvement as a result of vaccines. I liked your statistic, Marci, that we've saved millions of lives. So, yeah, you would much rather prefer a vaccine than the disease. No vaccine is totally safe, but not getting a vaccine is also not totally safe. So neither condition is totally safe. You have to weigh which is better. And in my opinion, you are much safer to get vaccinated than to take the risk of exposure and the diseases.
Yeah, that's well said. But I would want to emphasize that we're talking about safety and risk. You really have to look at it with an epidemiologist's perspective, a statistician. You need to look at the actual figures. When I saw in a film that with the early smallpox vaccination, 2% died, that is a scary big number, really scary, and I kind of applaud the people who did take that risk in spite of those quite horrible 2%. However, when we're looking at COVID or any other vaccines today, we're not looking at 2%. We're looking at unbelievably small numbers of individual cases. And when we talk about safety or side effects, it should also be noted that those side effects, if they occur, and they typically only occur in a small sample of people, they're kind of negligible. They may be a bother, but they have no long-term effects in many cases. The problem is people cannot handle big numbers really well, and that can easily be exploited. One example from a different arena, if you turn on the news, you will have 8 minutes of havoc, crashes, and murder and mayhem. If you dig a little deeper, you may realize that they shopped something that happened somewhere in this country of 330 million people and shove it right into your face, and the impression you get away with it is somebody gets mugged every 10 seconds and it's not safe to leave the house. And something similar happens when side effects or real damage caused by vaccines is held up. People get the wrong impression.
And just to emphasize that, you can see that same thing. One person gets mauled, something bad happens to 1 or 2 people, a small plane crashes, and it's horrible. 1.5 million people died from COVID in this country. And it's hard to even get your head around what 1.5 million people are. That's just an abstract number. Where I can picture those 3 children on that bus that just got run off the road, those 3 children died, and I can picture those 3 faces because they put them on the news. 1.5 million people is too much for our brains to get our heads around, so we have trouble really conceptualizing what that is. The question was, is there a sweet spot for herd immunity? And I think the sweet spot for herd immunity actually depends on the infection rate of the disease. How quickly it spreads. If I cough, are you all going to get it? Or so it's variable depending on the disease, which is why if you're interested, I can actually hand you this paper because it actually shows you. If you want to read a great JAMA paper, it actually shows that as we decrease our vaccination rates around the country, different infectious diseases will become more prevalent than others at a faster rate. So that gets at that exact question, that it's not as an easy answer. Measles is it's one of the most infectious things we've ever seen, I think, right? It's crazy infectious. So we need to be really high on measles, where maybe it's polio, maybe it could be less. Looks like you had a statistic on your phone.
I was just curious about the U.S. population. As of 2024, AI says it's 340.1 million. It also says this: what's the nation's progress on vaccinations? At least 270,227,181 people, or 81% of the population, have received at least one dose. Overall, 230,637,000 people, or 70% of the population, are considered fully vaccinated. Okay, so that's the 70% that you were talking about. I believe it's about leadership, really, and showing by example. The herd mentality speaks a lot stronger than the me generation, or, it's all about me. And there are people about that who are, deniers, and who are afraid of, certain individuals, Fauci, and other people, who were prominent in the CDC. I think leadership brings people along towards that, sweet spot of a herd mentality, so that we can follow what has worked and, let the me generation people learn from that rather than suffer.
And I look to states like Washington, Oregon, and California, who, in the face of other people saying we don't need to have vaccinations, they said we have a Western Alliance, or whatever they're calling it, the Pacific Coast Alliance, where they're saying, yep, these are the vaccine recommendations for our 3 states. New England's doing something similar with a carve-out for Massachusetts, which I'm not quite sure I understand, but New England's doing something similar. I would love for Colorado to say we're standing with whoever that is, right? We need to have the leadership to say, in our state, we think it's important, and we all stand together. So I think you're right, and I think it's our voice. We need to have that voice together, and with our elected leaders, our public health professionals, our, whoever that is, our religious leaders, to say, this is why this is important for you and for us, both.
There's one more thing that I want to say, or rather emphasize, because I started out with it. It's the power of propaganda. We shouldn't be too angry with the people who are climate or science deniers, because they really have been inundated by relentless propaganda every day, every night, and people don't realize propaganda works. The big lie totally works. We're all, if you don't want to use the word propaganda, you think about it in a different way. Socialization is what we call growing up in a society with their religious traditions, with their political traditions, that shapes you. Because it's all around you every day, all the time, and you think it's normal. Well, if you had been born in a village in Kenya, this would not be your worldview, and it's not your fault. You just happen to be in that place. And the people on the right who are constantly bombarded with falsehoods, you can't blame them, although you might be tempted to. So with that, let's thank our panel. Lists again, Dan and Marci and Bob Braden.